Hello, everybody. We are here with NSA Witherspoon and Polly Hoppin. I'm excited to have them here this year. They were here last year. They do critical work in preventing cancer for children, and we'd like to hear an update on what you're both doing. And why don't we start with Polly, if that's okay?
Good morning, everyone. Bill, just a hats off to you for another amazing organizing effort of this event. In addition to all the other things that you do with Less Cancer, we really appreciate the work that you do and this opportunity to share our very aligned work. So appreciation to you and all the many volunteers that you work with. My name's Polly Hoppin. I'm a research professor at the University of Massachusetts in Lowell, professor of public health with a focus on environment. And I work with colleagues who have training in environmental health sciences, public health, but also chemical engineering. We have a sister organization, the Toxic Use Reduction Institute, that works very closely with businesses to help them figure out how to reduce their use of environmental chemicals that are hazardous to human health. So we kind of go from the problem side, understanding the science that demonstrates links between environmental exposures and cancer, along with other chronic diseases, all the way to the solution side, including technical solutions as well as policy. So we've been involved in a number of efforts over the years to identify strategic collaborations between different kinds of organizations that by working together, those organizations can catalyze substantial change. And we have several efforts right now in the cancer arena. And I spoke to this conference last year about the issue of breast cancer and environment in particular. But the theme there, and the theme that we'll lift up today really, is that in order to catalyze change in a system that remains stuck in the production of chemicals that we know are hazardous to human health, the widespread exposure to people, including vulnerable people like children, like the elderly, like people who already have cancer, wide exposure to them, and then a healthcare system that needs to pay for the care of those folks when they get sick. That if we're going to disrupt that system, we need to bring together all of the players in that system and identify the contributions that they make to both the problem and the solution and work forward together. So the work we'll be talking about most today, I think, involves that kind of a strategic systems approach for the issue of cancer with a focus on the environment through the Cancer-Free Economy Network. And that's a 7-year-old initiative now to focus on environmental contributors, working with over 50 active organizations. And we have lots of activities and a number of updates that we can share with you over the course of this conversation. Mm-hmm. That's me.
That's great. Well, listen, you are a lot, and we're so grateful for your important work in pulling people together, not just educating and telling stories, because you're both of you are terrific storytellers, and that's how people learn, and it's how adults learn, and you are reaching important demographics and bridging critical gaps. We are so grateful for you. Before, I want to hear some updates from you, Polly, but I want to know how you came about with the name Cancer-Free Economy. Can you tell us about that?
Sure. That really was a name that was conceived around a work table where we were all brainstorming what it was that we really needed to focus on if we were to get this system unstuck. And we recognize that as the economy, and the assumption that in order for the economy to thrive, that we need to continue to rely on hazardous materials. And this sense that people have that there are trade-offs between jobs and environment, and between economic health more broadly and environment. And we wanted to send a signal to say, actually, there are not trade-offs there. Not that it's easy, but we can prioritize people's jobs and a thriving economy along with people's health. And that, in fact, people's health is fundamental to an economy thriving. So we wanted to have the word economy in there to highlight that and to include organizations, networks of businesses that are working on safer alternatives, organizations that drive consumer demand, which also focuses on an element of the economy. We wanted to be sure that those partners were at the table, in addition to the partners that are often at a cancer prevention table.
Mm-hmm. It resonates with me personally because I think people don't really, for years and years and years, I think I'm much older than both of you, but for years we have heard about the individual patient beating cancer. That's been we've turned cancer patients into athletes. And we have learned from that experience that the story is much bigger, that families are exploding taking care of cancer patients, that there aren't the resources, that it isn't just the chemotherapy, it isn't just the treatment or the surgery, all of which are critical. But there are all these other pieces that come with it that people lose sight of, like who's paying the bills? How are they getting groceries? Who's driving the kids to carpool? Who are handling some of these issues that now are really social justice issues, that they've become part of a optimistic demographic story that says less people are dying from cancer. Well, wait a minute. There's a whole other group of people that are getting cancer, and never before in the history of time have we had more cancer. Never. So, I think when Richard Nixon came out with his war on cancer, I was like in 5th grade, maybe. So now countless billions of dollars more are spent, and it's been pretty cataclysmic. So I wanted to get some updates. I appreciate you exploring this area of the economy because it's not a story that's told often. And if we can lift that up so people really understand it, I'd like to see that happen. So can you give me, Polly, some key updates that happened this year, things that you've been involved with that you might want to share with our audience?
Sure, and maybe I'll start out with the science side, and then NSA can shift into some of the programmatic work. But we just completed a review of the scientific literature on cancer and environment this year, and we've been involved over the years in convening a number of discussions among cancer researchers about the need to prioritize cancer and environment. And there was a very significant meeting a couple of years ago that we were involved in helping to organize, along with a number of other partners that the American Association of Cancer Research organized. And it was the first ever standalone meeting on environmental carcinogenesis. And then importantly, it had pathways to prevention. So the idea was understanding environmental contributors, but also then identifying ways to reduce those exposures as part of a cancer prevention agenda. So that was exciting. And one of the themes of that meeting was that the literature on these connections just grows every year. And so we just completed a review of 2021, the scientific literature on cancer and environment. And there were at least 115 studies that were published in the peer review literature. And overall, they just continue to strengthen the case for the importance of these connections and the opportunity that there is for reducing those environmental carcinogenic exposures as a contribution to cancer prevention. Among those 114, just to give you a sense, there were about 25 on air pollution in particular. Air pollution and its contribution to multiple kinds of cancer, but then also specific cancers. So I spoke to your group last year on breast cancer. There were 6 studies on air pollution and breast cancer, 9 on lung, some on ovarian, pancreatic, thyroid, prostate, leukemia, all related to air pollution in some way. For childhood cancer, there were 8 studies that we identified in 2021 alone. A number of those were on pesticides. The proximity of a residence to an agricultural field increases the risk of a child's cancer. The use of home and garden pesticides increases the risk of childhood leukemia. There's an air pollution study, really significant.
Can I just ask you one quick question about the pesticides, if that's okay?
Mm-hmm.
Not
Sure.
just because you have so many good anecdotes and stories here. One of our first projects here was trying to get a handle on pesticide drift reduction around health-affected communities like schools in the state of Virginia. With the onset of local farming and the interest in different agricultural programs like vineyards, those kinds of things, they were all great. You know, we all love local food, but some of these people were putting things in next to schools, and it was just like an unthought of risk at the time. Like, we don't have anything against wine, or I certainly don't, but they have, there is a place for everything. And I think, we're hearing a lot about PFAS now, which is just as critical, but it has really put issues like pesticides that we see every day that are in our neighborhood, that we're using in our local farms, our local gardens, and we've lost sight a little bit of, we just have lost focus on that because there have been some other things that have come to the forefront, including COVID. But, that's a really critical issue. And I love that you are exploring that, because I think there's been a bit of a pause in that interest. And, with everything that's going on now, we've never had more pesticide exposures. And I think it's a really important focus. I didn't mean to interrupt. I just wanted to mention that.
Yeah. So Bill, you're zeroing in on pesticides is really significant in terms of the strength of the literature on that topic. And we took a look for this childhood cancer prevention initiative that NSA will describe a little bit more, because it's been a really important focus for the Cancer Free Economy Network and other partners in a minute. But our conclusion in looking at the science on childhood cancer was that pesticides is one of 3 major risk factors of concern that have to do with the environment. And that means studies that have shown direct associations for kids in particular with pesticide exposure. And the 2021 studies only strengthen that connection. The other thing about pesticides is that there really are alternatives. As you know, it's well demonstrated that we can grow food, we can control weeds, we can do the things that we need to do without depending on pesticides that contribute to cancer. Again, doesn't mean it's going to be easy, but we knew it's possible. Other examples are, in municipal situations where cities have banned pesticide use on playgrounds or parks. That's really a movement that's taking off across the country. So really good area of focus, and thanks for emphasizing that and bringing it up. I can continue with just a couple more comments about the science, but if you'd like me to, but in sum, there has been really an important step forward in 2021 with the research literature. I'll just mention maybe one other category, and that is endocrine disruptors, which people I think have heard a lot about, which are chemicals that behave like hormones in the body, that mimic hormone function in the body, and therefore can disrupt it. And oftentimes we haven't thought of chemicals that are classified as endocrine disruptors as being carcinogenic. They're often not so-called complete carcinogens, but we're learning that they are contributing to the development of cancer. They're setting the body up for the development of cancer. So in this review of 2021 literature that we did, we have a category on endocrine disruptors for that reason. And there are at least 13 studies that looked at the issue of the contribution of endocrine disruptors to cancers. And you mentioned PFAS. There are about 10 studies on PFAS in cancer. That's, as you suggested, a really exploding field. So I'll stop on the science side. There's lots of other developments of programmatic activity that we've been involved in that we'd love to tell you a bit about. And I can hand it to Ensei to start with that.
Can I just make one quick comment here on the pesticide issues, just to wrap this up? When people are listening, it isn't, I always want to be clear that we're concerned about everybody's health. and including farmers' health. And some of these pesticides are, they've taken on the natural landscape of our lives. And so we don't really even see them. And so in our work to do these things, we're really interested in protecting everybody. And I know from my experiences early on, people misconstrued that to think, oh, it was like farmer against, consumer. And that wasn't the case at all. We found lots of farmers that didn't really understand what they were using or doing or where, and by no fault of them. It's people like you that we're so grateful for that are clearing these stories up. And I just wanted to point this out. This is for everyone's health. And I really appreciate your work. Thank you very much.
Yeah, thanks, Bill.
And say,
hello.
Love seeing you again.
It's really good to be here, and I want to share my sentiments with my friend Polly here. Your platform and all the many, many years of work of Less Cancer and this fantastic event are vital, I think, to continuing to, like you said, not only get the word out, but to also mobilize all of the listeners who in their own spheres of influence can truly make a difference. We do know that many voices together over the time, there's a precedence of this, can truly create the tipping point that we so desperately need in all communities and especially our most highest risk. So thank you again for this very nice invitation to join you today.
Well, we're grateful for your work because we know for anything to move this in a real way beyond moving the needle, we need people like both yourself and Polly to continue leading the charge in a way that's going to bring more and more people into the fold to help fight this wicked, wicked disease. So thank you very much.
Of course. And for some of my background, my training's in maternal and child health, public health, and I kind of stumbled into the environmental health arena. I'm so pleased that I did. And I've been with this wonderful nonprofit, the Children's Environmental Health Network, for over almost 22 years now. And we are celebrating 30 years as an organization in 2022. It's bittersweet, right? Because Bill, as you were just saying, hopefully we wouldn't be in a society that would need a big national nonprofit like ourselves to at least be one of many voices for children who at many times don't have their own voice, and the families and the communities that are protecting them and trying to protect them and serve and nurture them into their fullest potential. And yet here we are. I think our need is even more than ever. And we have a very interesting opportunity of a window of opportunity in history here with a lot of stars aligning. So again, it's extremely exciting to see the potential and opportunity. I think we all want to take full reign of this. And when it comes to truly turning course on this paradigm of cancer, we as a nonprofit focus on protecting children in all places where they spend time. And in particular, we're very much focused on their first environment, mom's womb. Which we do know, unfortunately, children are born free polluted. There's lots of peer-reviewed evidence to show that, sadly. So most, if not all of our children are starting off in the negative, if you will, when it comes to their health and well-being, unbeknownst to nothing that they have done. And at times we do know in the cancer arena, we are taught a lot about lifestyle changes that we individually can and should be doing. And while that may be true, it still does not speak to the increasing amount of incidence of cancer that we are seeing, and in particular among our childhood population, which is extremely alarming. We work and provide leadership in spaces that are major routes of exposure, like water. We're part of the Clean Water for All. We're a leader in the Healthy Air Partners movement. Air pollution, as Polly just mentioned, is a huge catalyst and route of exposure for all populations, and especially vulnerable populations. And certainly the cancer prevention arena. There is a whole nother side to this that we do not necessarily hear acknowledgement about when it comes to where the money is going in the cancer space, I should say. Predominantly, predominant amount of money is spent on research and treatment, which we all appreciate and have great value in. And we know that we need to balance out significantly the amount of attention and capacity and funding that goes to preventing those exposure routes, which have been, again, and continue to be exposed and lean on in our peer-reviewed literature for ways that we as society can do much, much better to protect all of us, especially our most vulnerable. If I could, I'd like to talk about the Childhood Cancer Prevention Initiative real briefly here, that the Cancer-Free Economy Network, in addition to a variety of other partners, has been at the table of. Last year in 2020, we launched the Childhood Cancer Prevention Initiative with key organizations in the childhood cancer prevention arena, like Prep for Gold, in the sustainable business partners arena, such as American Sustainable Business Network, and with health professionals, public health organizations, such as Children's Environmental Health Network, faith-based groups like Green the Church, and research institutions like University of Massachusetts at Lowell. And we've come together in a very unique way to create an awareness of the connection of environmental exposure routes within the diagnosis of some forms of childhood cancer. So with the re-release of this groundbreaking report that we did release last year, which happened in this past fall, we continue to identify key actions to advance solutions that can and will protect our children. And we have evidence of this in communities all over the country. This report, which was unique because it provides a review of available science that identifies trends in environmental chemicals related to the incidence of cancers. So we know that since the year I've been born, 1975, childhood cancers have increased steadily on an annual basis and are now the leading cause of death for children past infancy. We know that most common are our central nervous system and lymphomas among the childhood population. And there is an equity reality here because, for example, leukemia is much more predominant in Latinx children. So the science cases made in this report, again, as Polly mentioned, reviewing the available research and opportunities for prevention, as well as a business economic case and policy cases are also made. So on the pesticide discussion, there's pesticides, vehicle air related pollutants, paints and solvents identified as primary exposure pathways towards certain forms of childhood cancer. So our urgent agenda addresses those areas and really provides a narrowing priority focus on those areas that we can and should be leaning on to reduce those exposure pathways. So this year we launched the Pesticides Initiative within the Childhood Cancer Prevention Initiative, where we have conducted listening sessions with national and state pesticide advocate leading organizations. We've gathered a variety of information on their theory of change and identified areas where the Childhood Cancer Prevention Initiative could be most useful to their work and allowing them to take the lead in these arenas that many of them have been working in for decades. One of those areas is in support of Protect America's Children from Toxic Pesticides Act. This act was just reintroduced by Senator Booker in New Jersey in November, right before Thanksgiving. So when passed, this will remove the use of pesticides from our farming system, and not to mention a variety of other ways that pesticides are used to really diminish our dependency on this. We're also calling for the need to have a childhood cancer prevention research agenda, which we do not have. The National Cancer Institute should be leading this charge along with a host of government agencies whose missions will only benefit by less children and families having to deal with the physical, mental, and economic realities of cancer diagnosis.
You're doing amazing work, that's for sure. When we talk about these issues, some of us lose sight of where and how to address this, because there is so much information. And we know simply put, we know that often zip codes have a lot to do with where people live. Do they have health care? Is there access? Are they living downstream? And then there are those that think we're good to go. We're in a great neighborhood. There is no factory in sight, but they may themselves be having a small home garden that isn't really safe, that they may be using things in their home that aren't really safe. So this touches everybody. And the work that both you and Polly are doing is so critical in making sure it touches all lives. That, we always say it's less cancer for all, not less cancer for some. And for some of us, it's harder to really understand the lives and lifestyles of people, some of which are modifiable and many others that are not, which is why we need policy, which is why we need education, and which is why you two are here today, because you're both great educators. And we appreciate your work. Is there anything that I'm not asking that you would like to share, either of you, Polly or Nsé? Is there anything that you'd like to update us on?
Sure, I'll start. One thing I'd love to encourage people listening to consider is becoming involved in the process that happens in almost every state, which is to develop a state plan for cancer prevention and control. And that usually happens every 5 years. And it is funded by the Centers for Disease Control and Prevention, which provides the funding for the state government to have a cancer prevention and control program. And these coalitions are multifaceted. They have a lot of advocacy groups, cancer advocacy groups, some clinicians typically. Oftentimes, though, they don't have people who are concerned about or have lived experience with or scientific knowledge of environmental chemicals and pollutants. So the CDC this year, in partnership with the National Association of Chronic Disease Directors, has launched an effort to educate state cancer prevention control people about environmental chemicals and pollutants. And a number of us that are partners in the Cancer Free Economy Network are helping them to do that. So there was a webinar that was launched, webinar series in October, that was sort of the basics of Cancer and Environment 101 and some key concepts. And then coming up in the beginning of 2022, there'll be another one on evidence-informed interventions of what can state cancer programs do to actually reduce these exposures. But the coalitions that I talked about are the advisory bodies for those state cancer programs. So we in the Cancer Free Economy Network are going to be encouraging and supporting people with environmental health expertise to begin participating in these in several different states, at least in Iowa and California and Pennsylvania. And people who may be listening to this, we'd love to support you, encourage you to start attending your state cancer coalition meetings. So that's one thought. And then another is we are working with, as a first step, the Dana-Farber Cancer Institute in Boston is hosting a series on environmental chemicals, pollutants, and cancer. And that's going to be 3 sessions starting in February, as we all know, Cancer Prevention Month. 2 sessions, one February 3rd, another February 16th, and then a third one on March 1. And that's
National Cancer Prevention Day is on February 4th.
Yeah.
And which this probably will be running on February 4th. It's 3 days this year. So
great. And I know, Bill, hats off to you for your leadership in getting that day established. I know that was a huge amount of effort, and it's become a real organizing opportunity, galvanizing, day for people to showcase all the really good work that's going on. So
it is a working day, right? It's also World Cancer Day. And I think the first sponsor of that might have been a chemical company. So I am interested to see this work that you guys are doing. It's super critical. I did want to ask you, what is a guy like me, a C student guy like me, supposed to do to lower the risk in my own home? Do either of you have tips that you could share with me today and our audience about things that we might do in our home?
Sure. Thank you, Bill. And I think it doesn't matter, where we live, like you said, zip code, our sense of training, we're all in the same predicament. I'm that same mother, citizen who goes into the laundry aisle of the grocery store, and I'm just as overwhelmed. So first things first, take some time for your own health. Just as we might read labels of certain packages of food that we may decide to, prepare or bring home to our families, take the time to do that so you can find some lines of products that you feel comfortable with. Ask the type of questions that you have the right and deserve to be answered. Many times, unfortunately, a product like a household cleaner may send you to a website in this day and age. And sadly, that's a whole nother realm of advocacy labeling and how it's not empowering.
Social justice, because not everybody has access to the internet. Go ahead.
That's right. No, that's right. And sadly, my humble opinion is that's a way to kind of push us all down the line of just, I'm just going to buy this and hope it works out. No, that's not okay. We all have hard-earned money. We are the drivers of this economy is what I would encourage us to do. And what we have seen in the past is that when there is a boycott of sorts or a huge reduction of people no longer saying enough, I'm not going to purchase this anymore, I'm going to purchase this. Well, then you have the groundswell of the change of the pendulum swing there. And that's supply and demand comes into account. So read those labels, ask questions. Groups like us would be happy. There's many of us out here who would be happy to take your email, take your call, and help you walk through some of that. But thankfully, we are living in an age where even at the different range of different stores that one may shop at, there are options. There are organic options. There are chemical-free options. Just be aware of the labeling. Just because it says toxic-free does not mean anything. There's no regulatory body that looks at whether something is toxic-free. So there are people, there are sadly companies who are taking full advantage of this growing interest and demand in better educating ourselves on chemical risk. So just look at those. If you see a huge list of names that are very complicated and you can't even say them, odds are they're probably full of a lot of things that are not meant to be in our airways and in our homes. Try to go for things that are much more basic, elemental. And then there are groups like us who also put together formulas for basic cleaning where you don't even have to rely on a third-party cleaner. You can kind of pull together your own basic cleaning agents, which will do the same thing. So thankfully, there are a lot of options out here for us. It does take time to kind of find that line that you like or line that you're comfortable with or products that are more comfortable and aren't going to cause other irritation to your families or allergies. But when you find them, I think you will have great comfort in knowing that you are making some better decisions for yourself. But Paula, you may have other thoughts.
I think you've covered it really well. I think there is, I think, as you alluded to, an equity issue in terms of higher costs sometimes of these kinds of alternatives. So that's something that is really important to be aware of. And so in addition to making your own choices, advocacy on behalf of some of these safer alternatives and with a focus on the special circumstances of someone who, is facing eviction and how can they be expected to, pay more for a safer alternative when they can't even pay their rent. And I think COVID has just illuminated these disparities in people's lived experience and the lives that they are doing their best to live. So we're very aware of that in the Cancer Free Economy Network and doing a number of things to center equity in the work that we do. One of which is an emerging leaders cohort. So we have a cadre of mentors and mentees, and the mentees are largely young people of color who have an interest and a lot of lived experience and often academic training and other skills to bring to their development as young leaders. And so we're hoping to see more and more Black, Indigenous, other people of color in leadership positions of organizations from small to large in this arena of environment and chronic disease. So and I know those are concerns that you share as well.
Oh, absolutely. And yeah. I always love talking about these issues because I'm hoping, there's something that will resonate with somebody. For me, when we talk about stores, I'm so distracted. I often even find myself in the shampoo aisle looking at stuff like, I'm the last person that needs that. But it is, I find that before I go into a store, if I'm really organized with my thoughts and ideas, I have an easier time navigating those things. If I can't pronounce or say a word or even read a word, which is very possible, I don't buy it. It's just, it's too big of a relationship for me. So, I do tend to, which I don't think a lot of people in our audience understand, I do tend, when affordable, if I don't know my farmer, I do tend to reach for the green and white USDA organic label, which is not a perfect system, but we know just from that brand that there is less harm in that brand. And so there are times that I will reach for that because it is so overwhelming for so many consumers and including ourselves. We're in the business and we're like, what do you do? We're going through lists and stuff. So I just love the fact that you guys are out there doing this work that is saving lives every day. And I just hope that, next year we're going to have more good news to report. We are seeing a change in policies that, we can thank so many people like yourselves that are turning the corner now. We're seeing some good things happening, and I'm super grateful to both of you. So thanks for being here today.
Thank you, Bill.
Thanks again, Bill, for having us. Much appreciated.
You guys are the best. We appreciate you a lot. And so thank you for your good work. And thanks for being here.